Welcome, Lauren, to Anti-Aging Uncensored. I'm so thrilled that you're here today.
Great. Thank you for having me.
Well, this is a topic that, women have a lot of questions around. I personally was like, well, doesn't everyone know what's going on? What is Botox? All of that. And there were a lot of questions about what it does, but more importantly, about the variety of other things it's being used for rather than the typical. So I'm very excited to not only talk about what we sort of know and get a little bit more clarity around what Botox is, but all the possibilities it's being used for, even outside of the work that you do. So why don't we start off with the question, what is Botox?
Sure. So Botox is a neuromodulator, neurotoxin. Essentially, it's an acetylcholine uptake inhibitor. So it basically blocks the signaling chemical from your brain to your muscle that tells your muscle to twitch, thus relaxing the muscle.
That's it in a nutshell.
Yeah.
Well, it works. So, and then the word Botox is kind of like the word Kleenex, right? So there are other brands out there, right?
Yeah, in the US, we actually have, I think, 4 brands currently that are FDA approved for use in cosmetic injections. Dysport is probably the leading competitor to Botox. Botox is owned by a company called Allergan, and then they're responsible for like the Juvederm suite of products for fillers. People are familiar with that. And then Dysport is owned by Nestle Cosmetics now, but it used to be called Galderma. And that is Restylane family of products. And then there are 2 other ones that we don't carry at Skin Spirit, but I'm also familiar with. One is called Xeomin, and that's owned by Merz Aesthetic. They're the company who own the technology behind Ulthera, as well as Bellatero and other fillers in their suite. And then there's a newbie to the market called Jeuveau. It was launched, I think, right before 2020 started. So I think, 2019. It's sort of a new kid on the block.
Kid on the block, yeah.
The difference between them is really accessory proteins and their patents as a result. Some patients will tell you that they have better results or duration with one neurotoxin versus the other. The accessory proteins on Dysport are different than the accessory proteins on Botox. And what that means is the molecular weight varies from one formulation to another, but they're all a form of onabotulinum toxin type A.
So as a consumer, though, do we need to know what it is, or do we just rely on our like you to tell us what we need?
I think it's good as an injector for us to make sure that we're familiar with all the possibilities that are out there. I don't think as a consumer, you necessarily need to know the difference between which protein matters. But what goes along with some of these different companies is they do have loyalty programs. So you end up building up points, like frequent flyer miles for one brand or another. The only thing to remember with Dysport, why some patients would want to avoid that, it does have what's called milk protein in it, and it has some lactose. So patients who have an anaphylactic milk protein allergy should not be using Dysport.
Good to know. Good to know. Yeah, that's important. So do you find that there is an age where it's not just women, I'm imagining it's also men, but like where women are starting to think about using it? Is there a too early age? What are your thoughts around that? And what are you seeing?
I mean, I'll definitely say that my patient population has definitely lowered in terms of its age range. Younger patients more frequently are coming in for Botox for the first time. For baby Botox or preventative Botox, which has become a
baby Botox. I've never heard of that
term, I guess, or like a hot topic lately. But yeah, so that's out there. And what that means, baby Botox, that term is just low doses of Botox used to prevent the formation of fine lines and wrinkles in various areas where we're treating. Is there an age? FDA trials any kind of clinical studies have only been done on people who are 18 and over. So personally, I wouldn't feel comfortable treating someone under the age of 18. And, I usually just say, if something's bugging you, talk to us about it, come in for a consult. It might not be a Botox issue or a neurotoxin issue. It could be that you need a filler or something different and you just think you need. So I consults with the most.
My understanding, kind of what you're saying, is that they're doing it for prevention versus treating what you have. Right. Does it have a lasting effect, or like if you're doing it over a certain period of time, like 4 years or whatever? I was just curious.
It's more of in terms of preventative, I guess the way to think about it is, if you never get the line in the first place, then we're not doing corrective Botox. We're then doing just something that's preventing that breakdown of inelasticity and collagen over time. So it becomes a little bit easier to treat with lower dose. Whereas if you start later in life and you have a strong 11, or you strong lines across the forehead, you may need a higher dose. That's not to say that younger people with those sudden lines don't need higher doses. Sometimes they do too. It all just depends on your anatomy.
Got it. So what is the risks? What are the risks for women or men getting injections like this? Are there risks? Yeah,
I mean, of course. There's always risks for anything, right? In our consent form, we have various risks. The most common, there's like 3 main risks that patients talk about and that are on the packaging. One is going to be called eyelid ptosis, and that's when you get a little bit of a droopy eyelid, kind of has trouble coming back up again. That's in less than 4% of patients. Actually, 3% have reported that issue. The other issue that some patients do notice is edema or swelling around the eyelid. And again, that's a low percentage, around 1% of patients. On the forehead line, some patients, actually a fair amount of patients I've noticed, do report headache on onset, which does dissipate over time. And what's called brow ptosis, which is really not necessarily a risk associated with the medication, but more about injection technique.
So what is brow ptosis?
When you drop your brow.
Oh, got it. Yeah. So like a droopy brow.
Yeah. Ptosis or ptotic is just a science word for drooping or drop or inability to use it. So.
Got it. So why don't we dive in now to the myriad of uses that are out there, and let's start on the beauty side, which I know most people will be interested in. But I mean, obviously, how I know it and most people know it is through Wrinkles.
Yeah.
But when you and I sat down, you shared with me all these other places that you guys are using it, and how multifaceted it is. So maybe you can start diving into that a little bit.
Sure. So, Botox Cosmetic, which is different than medical Botox, which is a product I'm not going to talk about just because I don't have any familiarity with it. But as far as Botox Cosmetic is concerned, there are all sorts of areas over the face. Any muscle that's used in facial expression can be neurotoxined or any muscle really can be neurotoxined in order to achieve a specific goal. Some places that are pretty common are the masseter, which is like at the angle of your jawline.
That's the back of your jawline?
Yeah, sort of it's called the mandibular angle here of your jaw. And what that's used for cosmetically is for jawline slimming. One of the benefits of that is also you get some relief from clenching of the teeth. But the purpose that we do it for is for slimming. So it makes your face look a little thinner. Other places would be the platysmal bands or the neck to help with tech neck. Lots of people are
and tech neck is that there's wrinkles from being down, having your head down, or
horizontal lines from doing this all the time, or putting your head back,
pushing your head back.
Yeah, I've just Botoxed mine, so I can't really make that face anymore, but I could. Chin is very common, especially in women who are aging. As we age, some women get what's called a orange peel effect on the chin.
Mm-hmm.
And it tends to be these little muscle adhesions that are pulling the skin inward. So it almost looks like a dimpled orange peel.
Right.
With the Botox, you can relax that so it doesn't look as
yeah, it almost looks like modeled or something like very, very weird effect. And it does show up when you are older. I'd never really noticed it before.
Yeah.
What about the lip area?
Totally. So Botox around the mouth. Some of the most common ones I'm doing, especially in my younger patients, are corrective Botox for what's called the gummy smile. And that's when we inject higher up, almost near the nose, which drops the muscle that lifts the lip, called the levator labialis, labii. Not that you necessarily.
Okay. So the injection goes in near the nose?
Yeah. So if you smile really big, you can kind of see the muscle inserts, and then you inject right there. And that drops down.
So it actually relaxes the where is it, like your jowl area? Is that how you're sort of?
No, so it's for the upper lip, right? So patients who have exposed gum line, I don't know if you've ever seen that, when they have little, like, smaller teeth and a lot of gum show. It's called gummy. Also, we do that a lot just to drop that lip down so you have less gum showing.
Got it. Got it.
Alternative side, I have a lot of younger patients who are doing what's called the lip flip. So that is Botox around the mouth in the scalarius oris muscle, which is a big muscle that runs all around the mouth. And we just inject that to efface the lip. So it gives the effect of having like a lip filler, because you have a little bit more lip showing than getting it turned under. No, it doesn't work on everyone. It's definitely anatomically dependent. Again, consultation with someone who's familiar with doing that is important.
Yeah, it's shocking what happens to our lips as we get older. They really do thin. Yeah,
and they also turn under. So around the mouth, you'll notice as you get older, you get what are called like vertical rhytids or vertical lines. Some people call them smoker's lines, but kind of a misnomer, because you don't have to be a smoker to get those. So that's another way to treat them, is by Botox just along the lip line to relax that muscle. And it does the same thing. It sort of effaces the lip slightly. So older patients like that, they have more lip showing again, like they used to. And then relaxation of those lines.
Oh, that's awesome. Is there anything around like the smile at all?
Yeah. So there's plenty of stuff we can do in the face. Botox. I mean, it can go all sorts of places. It's very fun. It's definitely a more difficult area to inject, and smaller dosage is really important in that area. So depressor anguli oris, which is commonly called the DAO, is the muscle that pulls downward. So these guys.
So if you have a downward smile.
Yeah, exactly. You use that muscle that's pulling down, so you get the effect of upturning the smile.
Got it.
What else can I do down there? Oh, tip of the nose. That's a fun one.
What is the tip of the nose?
Yeah, so we can Botox at the base of the nose right here. And effectively that releases, on some patients, not everyone, you have to be a good candidate. If people that have noses that go downward, it can pop. You have a little bit more of a cute nose tip.
So instead of the lip flip, it's the nose flip.
The nose flip, yeah. And there's also, along with that, moving upward, something called Botox for bunny lines. So the whole upper third of the face is always trying to express, right? This is where we have all of our muscles of facial expression, for the most part, is up here in the upper third. When you've Botoxed your eyes or your crow's feet for a long time, sometimes we'll get muscle recruitment. So other areas of the face will try to work hard enough to express. And one of those areas is the nose. It's called the nasalis. It's kind of like there.
It's like almost like near on. I don't even know how to describe it. Like your inner eyes. Yeah.
Side of your nose. Yeah. So the nasalis muscle it lays sort of flat on the side of the nose on both sides.
Got it.
And over time, that becomes an area that you might want to address with your injector, because you do have an increase in movement there when you've been doing Botox around the eyes for a long time. Same thing, why we recommend always treating the whole area and not just a specific zone. Like with the frown or the glabellar complex, it's important to remember that the glabella has an effect on the frontalis, which is the forehead.
So the glabella is the 11s, like that whole center area.
Yeah. So those muscles pull inward and downward, and the frontalis pulls up vertically, which is why you end up with horizontal lines, because you're constantly moving that skin and bending it. So it's important to remember when you're injecting for the frown that you may also need to be injected on your forehead, because that helps to balance the two muscles. So you're not hyperactive and getting like the Spock brow or the Ursula brow or the Jack Nicholson, whatever you want to call it. Afterwards.
That's so funny. So you mentioned the clenching of the jaw part earlier around the jawline. Right. Is it used for TMJ too? So people that have like ongoing, clenching and issues with that? Because it's a pretty big issue.
Bruxism as well as TMJ. There are dentists and orthodontists who specialize that, especially here in the city. I know there's several who specialize in TMJ treatment. And with that, they will inject the masseter, the temporalis muscle, which runs along the temple. The temple side. Mm-hmm. Yeah. And so the TMJ actually stands for temporalis mandibular junction, right? So it's basically what's involved in chewing and grinding. So they'll do Botox, usually 50 units per side, which is quite a bit, in both the temple and the masseter for correction of that. We just do it for aesthetic reasons, but it does have an added bonus of not being able to clench if you're a clencher.
Yeah. I mean, I know some people that deal with it, and to have a solution like that would be incredible, not just having to wear a mouth guard, right? So,
probably still want to wear your mouth guard. Well,
you do? Okay.
Talk to your doctor about that.
There goes my theory. Okay. Anyway, so, now let's get away from the face. Where else are you guys and other, places like what you do, using it? Using Botox?
Yeah, so the neck is probably the next biggest area. Like we talked about before, the platysmal bands, but then there's also something called microtox, which has gained popularity in the last couple of years, which is injecting superficially on the skin for textural support. So helping with those, as we age, we get that sort of like goose skin. I don't know how else to describe, chicken skin, maybe?
Yeah, like thin, very thin sort of looking.
And it sort of gets crepey. And so by injecting superficially, we can help to relax those superficial muscles in the skin and kind of even it out. So that's very common.
And that's on your neck that you were talking about. They're like sort of the crepey neck
region, submandibular region. And then the axilla or underarm is something that we do very commonly. I personally get it done every 6 months. It's called hyperhidrosis treatment. So what that does is by injecting, again, superficially into the skin, you can control sweating. So you can eliminate sweating under your arms. I know, crazy, amazing.
That's amazing.
A lot of my patients who are coming up on their wedding.
Great idea.
They love doing that, a couple months before or even a month before, because they have all those, events leading up to it. Because you don't want to have, sweaty armpits when you're getting married. So that one's very common and popular in the summertime. I do it every 6 months just because it's expensive. But ideal world, quarterly would be awesome.
So, and does it sweaty palms? Will it do the same thing for your palms? I can't even imagine getting injections in my palms though, but.
Yeah, I mean, a physician in a different specialty would definitely be able to inject for sweaty palms. I don't do that, but it's a little. which is one of the main reasons we don't do it. And, you want to make sure that it's being done right by a specialist who really knows the anatomy of the hand well.
Mm-hmm.
You can do it for the feet, sweaty feet, which is a common problem for people. And again, it would be through a different physician. That would be Botox, medical Botox, as opposed to Botox Cosmetic that would be used.
Got it. So there is a difference.
There are different FDA approvals, different patents, different studies, different packaging, even, and different distribution between Botox Cosmetic and medical Botox.
Got it. And some of the other areas that are sort of outside sort of the beauty realm that we're talking about, that I have read about, are things that medical Botox helps with, are things like overactive bladder, and cervical dystonia, muscle spasms, even incontinence it's being used for. It's pretty fascinating. Anything else that surprised you about what it's being used for?
I mean, you have to think, surprising maybe, but, anywhere where there's a muscle that's involved in the reason for the disease process, Botox can potentially help. Because you have to think about what the medication itself is doing. It's relaxing a muscle. So anywhere where that's an issue, Botox could potentially be used. Again, I don't inject medical Botox, but
right.
I tend to get it done for migraines, which is, a neurologist is doing that, and they're injecting all over the scalp, the occipitalis muscle, which also innervates with the frontalis. So you do get some relief from your forehead lines if you get the migraine Botox, which is nice.
It is nice.
Yeah. It's commonly used for laryngeal spasms, which people who have a very shaky voice, it's used due to muscle vibration sometimes, and that I inject that. It's all over the place.
Wow. Yeah, I feel like it hasn't even been tapped for everything that is possible yet. Or at least we haven't heard about it.
Yeah. Well, I think in the medical community, there's definitely a lot of discussion about it. Allergan actually has 800 patents for uses of Botox that are not cosmetic. The process of Botox and where it is today, it all began in 1989. They had it patented, or the formulation, and that was used medically for what's called blepharospasm, or eye twitching, all the time.
Yeah.
And they were injecting patients along the crow's feet area, along the orbicularis oculi muscle, the lateral aspect. And they found that people didn't get wrinkles. Obviously, cosmetic world, we're going to jump on that. So, that's how we got it. But it all came from a medical side.
How long does it take usually to see effect from it on your face?
So, great question. Everyone's different. Allergan will tell you that there are patients who report Botox onsetting between 48 and 72 hours. I don't have patients come back for touch-ups until the 2-week mark, because that's generally when you can guarantee that all of the Botox has set in. And what the difference is between, what we talked a little bit before about the differences between Dysport, Botox, et cetera, those accessory proteins, where they do come into play is onset. With that molecular weight, some neurotoxins can onset a little faster than others. Some take longer to start working. For the most part, the duration is still the same. And most patients are getting 3 to 4 months of actual medication efficacy. What that doesn't include, though, is what's called cumulative atrophy of the muscle. So if you've been doing Botox for a very long time and you're consistent with your Botox, the muscle just continues to get weakened and weakened. And in some cases, they no longer need to do the forehead because they've done it for so long. And it just is something that they don't have to do anymore.
Well, that would beg the argument that when you're younger and you're using it, it would have a longer lasting effect over a period of time.
Yeah. That being said, though, there's also the flip side to that, where incidence of people who develop protein, what am I trying to say? They develop an antibody to Botox. It's a lot more common if you're using Botox too soon in between treatments or for an extended period of time. So the longer you've been using Botox, the more likely you are to develop an immunity to the effects, which is kind of a bummer.
Wow. Didn't know that.
Yeah, but again, very uncommon. The percentages, I don't have those in front of me, but it's pretty low with people who are truly immune to it or have built up antibodies against it.
Very interesting. So if someone was just sort of wanting to find, talk to someone like yourself, what do you think is the best way to research? Because I know there are lots of places out there that, are offering these kinds of treatments, Botox, and we're only talking right now about the beauty Botox area. So, what are the questions they should be asking?
I mean, one way to go about it is definitely through Yelp. Obviously, if you're the Yelp reviews of a medical spa, that's always going to be helpful. You want to see a place that has consistent reviews over time, and a lot of them. That's helpful. But right off the bat, going to Allergan's website, botoxcosmetic.com, you can actually enter your zip code, and then it'll bring up providers who are licensed through, or not licensed, but they are certified Allergan Botox providers, such as Skin Spirit.
Good idea.
Yeah,
for sure. I mean, that's how I found you guys.
And then maybe narrow it through Yelp that way.
That's a great idea. So besides Botox, what are some of your other favorite treatments that you've seen that have given the best results?
I guess, for me personally, like, what do I like doing, or what do I like seeing my patients?
Which ones have you seen the most results from?
Filler is always a good one. Hyaluronic acid fillers, they're instant gratification for people. Once I inject it, that's pretty much what it's going to look like. Then it swells and then comes back down. And that helps with anti-aging and, like the lifting and making sure that you're not shifting volume south, right? Because the fat pads as we age move. So we're just sort of replacing fat pad with that. So one of my other favorites is probably, I do love IPL. I love it. It's highly satisfying for patients because, all this cumulative sun damage from over the years of like not wearing sunscreen and like using sunbeds that we should never have done.
I'm guilty.
Yeah, same. Believe it or not, this pale ginger was in tanning bed. That is really satisfying to have come off, as well as the redness reduction and the little vessels around the nose. Those are really
the
fun.
broken. What do you call? Is that like just broken capillaries, or what are those called?
Well, they're
hairlines.
Telangiectasias is what they're called. Whatever.
The scientific word.
Broken isn't really the right term, although everyone says that. They're superficial blood vessels because they're not broken; they're working. That's the problem, because you can see them working because they're red. So IPL is actually coagulating those blood vessels so that they do actually stop working, because we're using heat to stop the blood flow.
And I'll ask you about one other, because I know it's become extremely popular recently, and I've had even friends, ask about it, and that is Kybella.
Oh, yeah.
Because as we get older, our chins go south and east and west and
everywhere in between. So I mean, as we get older, patients may or may not be good candidates for Kybella, and that's something that you would want to talk about with your aesthetic provider. But Kybella, which is deoxycholic acid, synthetic, and it's essentially synthetic bile salts. And bile in the human body functions to dissolve fat in the digestive tract. So what that helps us do is we can inject it, and then the fat goes away permanently, which is amazing.
And they're only doing this in the neck? What about the tummy?
So, right? Yeah. There are what's called on-label and off-label uses for Botox, as well as anything in cosmetic world. What we talked about,
right,
the lower face, that's all off-label Botox. The only thing that's on-label for Botox right now is the frown. And then they also have indications for other areas, but it's just the upper third. Kybella, the only place that it's approved but from the FDA is called the submental region, which is the double chin. But there are plenty of other places that we can use it on the body, and those are being explored.
I cannot wait to hear that. So, but you mentioned before that some people might not be a good candidate, or older women or men might not be good candidates.
And sometimes younger women are not good candidates either. It really depends on your anatomy. If you have really visible platysmal bands, medial ones, which are the ones that run
the
esophagus there, the neck or throat. If those are really visible when you have the double chin, if I remove that fat, they're actually going to become more visible. So that's something that we have to take into consideration. Other things that would make you not a great candidate would be if you have a lot of skin laxity. So you don't have a lot of elasticity in your skin. We're removing volume. So anytime you remove volume without tightening the skin, you can get saggy chicken neck, right? So you wouldn't want to do something that's going to make it worse than what it looks.
Not saggy chicken neck. No one I know has ever asked for that.
No. Once like the turkey gobbler. No, it's not cute.
So it's really, when you think about Kybella, it's focused on fat. It's focused on excess fat, not excess skin.
Right, exactly.
There's a difference.
Definitely. And, Kybella can have, because of the inflammatory process associated with it, the swelling, which is intense. Although Allergan won't tell you that it's intense. I feel like it's intense. You get inflammation. And then as a result, you do get some neocollagenesis, which just means like producing new collagen, which can thicken the skin, but not enough to be clinically significant. So that's an important thing to remember. So,
wow. I think it actually sounds really, really exciting.
Kybella is the coolest. I love it.
Yeah, that to me sounds like a good one. And IPL has been around for a while. But it has extreme benefits to people, especially I had it done years ago, and I'll never forget the one time I had it done when I went in and they kept talking about the coffee grinds that are going to come up from your skin. I was very fair and I got burned many a time. And so all of that discoloration came out and I literally looked like I had coffee all over my face for a couple days.
Satisfying. And what that is the pigment, because it's been heated, it then comes to the surface and sloughs off, which is another reason why getting a consultation is important before just booking these, because not everyone is a really good candidate for IPL. If skin types 1 through 4 are very safe, obviously. If you have more melanin-rich skin, you may not be a good candidate for IPL, in which case there are tons of other options that we can explore. Whether it's chemical peels or treatments that involve like lasers without heat that aren't targeting melanin.
So last question, what would you tell your younger self about her health?
I would say wear more sunscreen. We're not like one. You're pale. Get over it.
Even if you're not pale.
Yeah, even if you're not pale, everyone should be wearing sunscreen. But to myself, I would just be like, you're not going to.
Oh, yeah, you're right. Sorry.
So stop tanning beds, use more sunscreen.
Stop using tanning beds. Yep.
Oh my gosh. And I would also tell myself, make working out a daily habit, not just something you do for sports, because I was really active in sports. But once I stopped playing sports, I didn't want to work out,
That happened to me with dance. I used to take dance classes every single day. And the minute I sort of like dropped it as my major in college, it just like never went back and never felt the need, because it was dance that I loved, not the working out part of dance. So I think that's a great piece of advice to tell our younger selves. So,
and always take the stairs.
That's a good one. That is a good one. So how can people find you? Like online?
So, you can find me on Skin Spirit's website. skinspirit.com. And then you can also find me through my Instagram, which is at the fiery RN.
Great. We'll link to that. And we're also going to link to Skin Spirit, which is just an amazing, I mean, in all honesty, it was the Yelp reviews just got me because there were such raving fans of not only the way the treatments were done, right, but the way the evaluation process as well, which is great. So it's not like, hey, we're going to do everything right on you tomorrow. It's like, these are the things that you can consider.
Right. Yeah. And putting together a treatment plan with your provider that is sort of all encompassing. So you know what your goals are, and then coming together. And I like being collaborative with my patients and figuring out that process together. So yeah, you can find me those places, or you can Google me. I'm Googleable.
Awesome. Well, I can't thank you enough. I really am looking forward to being able to talk about the future of Kybella in my tummy someday. So
it's also cool sculpting for that. So don't forget
yeah, cool sculpting. Yeah, I've heard amazing things about it. I've heard amazing things
about it. I've done it a bunch of times.
Really? Okay. We'll have to talk about that. Excellent. Another podcast. Well, thanks so much for joining me. I was so excited to get you because when you started telling me all the different things that this one, medication and solution does, I just thought this is a really interesting topic. And I love that it's kind of going beyond just, wrinkles.
Yeah, totally. I mean, Botox is magic.
Yeah.
It really is. And for the same price as an expensive eye cream, you can get your crow's feet injected. So which is going to be more effective? Probably the Botox.
Yeah. Yep. Well, thank you so much, Lauren.
So nice to see you. Bye, Jill.